My name's Professor Justin Stebbing. I'm Professor of Cancer Medicine and Oncology at Imperial College London. And I'm here to help with what is turning out to be a massive cancer problem in India. Many of my patients ask me how they feel during and after anti-cancer therapy, such as chemotherapy, and understandably, people have heard a lot of stories about it and are scared, but what I would tell you is that the situation has changed and is changing for the better. I tell most of my patients to try and lead a normal life during their treatment, and those who lead a normal life and don't focus on their cancer actually seem to have better outcomes. These drugs can make you feel tired, they can cause hair loss, nausea, they can suppress the bone marrow leading to infections, but our ability to counteract these side effects is far, far better than it ever used to be. So for the infection risk, which people like me used to worry about so much in our patients, we can easily stimulate the bone marrow using drugs such as GCSF. We have fabulous anti-vomiting drugs called antiemetics, which in so many cases totally eradicate even feelings of nausea. Cold caps can deal with hair loss, but of course there are a lot of obscure side effects. For example, in breast cancer treatment in younger women, infertility can be a problem, but our fertility services are much better. Effects on the heart can be improved, and with immunotherapies, if we recognize the effects on the colon or the lungs early enough, a simple course of steroids is usually enough to eradicate those rare side effects. One of the biggest problems I have is at the end of treatment, people ask, am I cured now? And that's something that we're working on by combining research with patient care. For the most part, there's no simple blood test for cancer like there is glucose for diabetes. So at the end of treatment for a stage 3 breast cancer with chemotherapy, women will say, Professor Stebbing, am I cured now? And they've been through a difficult time over the last 6 months. They then undergo hormonal therapy or radiotherapy, drugs such as Herceptin or other targeted therapies, or even clinical trials to improve the cure rate and reduce the death rate by preventing relapse. But the reality is, we're using modern techniques such as cell-free DNA to look for cancer DNA in the blood, and other investigations, including PET scanning and regular scans, but we still aren't really sure how to absolutely tell if someone is going to be cured. But going forwards, we will be able to tell. We know that these medicines really improve both the quantity and quality of life with people. We know that not only are the side effects from the drugs better, but the way we manage the side effects from the drugs is so much better. It's a bit like a car. The cars today can be the same as the cars 20 years ago, but the radio, the sunroof, the air conditioning, the security system, the comfort is so much better. We're doing that now with our anti-cancer treatments to improve the lives of people affected by cancer. In combination with that, we're detecting the disease earlier. By doing that, with better drugs, we're increasing the cure rate, and we're making people aware of harms such as tobacco and alcohol, so we're preventing cancers ever occurring in the first place. Thank you very much.